We have the most restrictive provisions in the entire country on the ability for the legislature and any governing body to raise the revenue it needs to address the needs in the community.
Hi folks, this is Alex with the Community Project. Today I'm here with County Commissioner Claire Levy, and we are talking about the Ballot Measure 1B that's concerning behavioral health. Mm-hmm. Claire, can you tell us what it is and why we're doing it?
Yes. What is it?
What is it?
So it is a measure that's on the ballot. People have those ballots on their kitchen table right now to put in a new sales tax that will fund mental health treatment, prevention, same for substance use treatment, recovery services, all throughout Boulder County.
So when you say mental health services, what all does that cover?
It covers things like crisis intervention, suicide prevention, actual treatment. So we will fund, many people know of Mental Health Partners, an organization that has clinical social workers, psychiatrists on staff will help fund those organizations. Recovery services, so it might be peer supports, like funding, peer groups to help people stay sober. So just a whole range of services.
And that also includes children. So anybody that needs mental health services will be able to benefit from this.
Yes. Yeah. It's not specific to one single population.
So you are the author of this ballot measure. Yeah. What did you see that made you feel like it was important to get this passed?
Yeah, well, this has been an issue that has been developing really over so I've been in office now almost 5 years. And before I got elected, there was a group of people that was talking about the need to have some local funding for mental health. Because the state, we're either, depending on the year, we're like 49th, 50th, always near the bottom in funding for mental health. Local governments are not funded for this kind of work. So there was no money, and there's a lot of need. And other communities, primarily Denver, had passed a local tax. And so folks were just talking about how we needed to do that here too, in Boulder County. And I got elected in 2020, but, that might ring a bell as, pandemic. Yep. So that wasn't a great time to be putting a new tax on the ballot and talking about something completely different. And, so it's taken a while to do the needs assessment, do the community outreach work, get the thing ready. But the main thing is, in Colorado anyway, is that there just isn't any other money for mental health kinds of services if we don't generate it locally.
Why is that?
Well, that's a long...
Yeah, I'm sure.
It goes to things like the Taxpayer Bill of Rights, and I hate that name because what it is it screws. But, we have the most restrictive provisions in the entire country on the ability for the legislature and any governing body to raise the revenue it needs to address the needs in the community. Everything has to go to a vote. And so, we underfund education. Mental health isn't alone in that, but it's kind of like the last thing people think of. And they always think it's somebody else's problem and somebody else is going to fix it. But it's just been historically underfunded.
So do you think is it the local community's obligation to fund these programs? Do you feel that way? Or
I guess I would, in an ideal world, I would say no, but there is no other way to fund it. The state is not going to fund it. They're cutting services. They've got $1 billion hole. They had $1 billion hole last year. They're going to have another $1 billion hole next year. Even without all of that, they didn't have the room in the budget for it. What funding the federal government provides is in just really narrowly targeted grants. They don't just issue money and say, here, go do a mental health program in your county and do whatever you think the needs are. So to do the kind of thing that we want to do, which is this comprehensive systemic approach that goes from prevention, crisis intervention, treatment, recovery, we really need money that we can control. So all the other money comes with all these strings attached about you can only serve this population and you can only do these things with it. And we really feel like we need something that is much more systemic.
That's pretty different than what's happening now, correct? Like
Yeah.
Funding comes in through the federal and state channels, and like you're saying, it goes to
narrow, specific things.
How is this different? So we would have control over it. How does that look when we have control over it as a
well, I mean, what little money there is that we have, right? It's left a lot of gaps. So there's not a lot of money for prevention, for instance. And what does prevention look like? We used American Rescue Plan Act money, ARPA for short, to provide money to both of the school districts in Boulder County so that they could have more counseling in those buildings. And they're with our kids 8 hours a day. So that's a thing that the state was cutting back on funding for schools to just do the basics. That's an example of something we can fund locally that there just wasn't any other kind of money for. Yeah.
And there's, we specifically work with individuals that are homeless. How do you think that this money could affect that population? What do you see?
Yeah. Tremendously. So, a couple of key areas, but really all across the board here. Just taking All Roads, which is the homeless service main provider of services in the city of Boulder. Like, they have some money that they've gotten through grants for clinicians to be at the day shelter. They do case management for people that are at the permanent supportive housing Bluebird. That money is going to run out. This money, the 1B funding, can help support those services so that folks that are ready to be housed can get housed and have the support they need to be stable. If it's a case manager that helps them remember to take medication or check in with a therapist or whatever, So funding those kinds of services are really important. Just at the whole issue that people see so often, particularly with the unhoused population, but by no means exclusively, of, having a crisis of some sort, a psychotic episode, going to the emergency department. For many people, being discharged to, even if they have a home, is not a good idea because they may not have the stability and the supports they need. But for somebody who does not have a home, you're being discharged right back to maybe the triggering environment that you are in. So this is maybe a little bit of a more ambitious, longer-term thing that we're hoping to do with this money, if it gets extended, would be to have that step-down housing available for people that still need to be in a supportive environment before they're ready to be on their own. So, those are a couple of examples.
So this could actually be used to provide housing?
We wouldn't use it for the housing itself.
Okay.
Maybe not, probably not, because it's not enough money. Right. But it could fund the services for that.
And this is just it's a 3-year plan right now, but I think that was stripped down from a 15-year?
Yeah.
Is that?
The original version that I wrote was 15 years. And what got referred after a lot of testimony and iterations and back and forth and compromise was 3 years. And at the time, it wasn't that, oh, in 3 years we will have solved this problem and nobody will have a mental health need. Addiction will be a thing of the past. It was just there was a desire to have more work on exactly what is the priority population, exactly where the services are going to go. I think, let's see how it goes for 3 years, see if the community feels like the most important needs are being met, and then we'll go to the voters and ask them for a longer term tax.
So the proof's in the pudding, I guess, huh?
Yeah. Yeah. And we'll do a lot of evaluation. We'll get reporting on who's being served, what the outcomes are, all of that, so that we can go to the voters and say, look what we did in 3 years. Now can we do this for longer?
Now, you had mentioned the behavioral roadmap. Mm-hmm. What does that look like for Boulder County? I know it's a massive document, but
yeah.
Is there a plan for this, I guess?
Yeah, I mean, that's been the big question, because it's like a 125-page document, and it's got a lot of stuff in it. And when the project was begun and in 2021, the hope, I think the goal was that it would truly be a roadmap. These are the gaps. These are the needs. This is what we're going to do to meet those needs. And, that we need this many clinicians and this many beds. And as a result of the process, which was a 2+ year process with huge amount of outreach, what they ended up creating, is really more of an assessment of what do we have. It's more than that, actually. I think roadmap is the name we gave it, but it does point to the gaps and the needs. But it also created a whole set of values, a vision for how services would be provided, equitable access, all kinds of ideas around just, what the values are of a system that we should have.
Yep.
Part of it was just looking at what services, inventorying the services, all the different funding sources that are available. I think wow. So a lot of it was just, this is what we have. This would be an ideal end state. And that was just too big to take and say, okay, if we're going to have $13.8 million, which is what this tax will generate every year, that was a little bit too big and vague to say, here's exactly what we need to fund. So that report, the roadmap, we adopted it in 2023. Then we said, now we need to have an implementation plan. It's still considered a draft because we haven't had a formal presentation and stamped it and said yes yet. But that 141 page or whatever it is document has now been really worked on and distilled into these 5 core service areas. And again, work on what are the values that we're trying to achieve here.
You said there was 5 key areas.
Mm-hmm.
Where do you think the majority of that money will end up? Do you have kind of an idea? I know it's not designated yet, but...
Well, yes. I do, in that, so the original plan that I had written up to refer to the ballot did have percentages allocated to the 5 areas.
Okay.
We didn't end up adopting it that way, just because there needed to be some fluidity, and we didn't want to have, formal, this goes in this bucket and that in there. But treatment had been identified for 40% of the funds.
And is that mental health or
it's
substance?
Both. It's both.
Okay.
Just behavioral health broadly. So it's really both. And 40% because it's the most expensive thing to do. And it's the area where we have the biggest unmet need. The thing I haven't mentioned in these 5 areas is navigation. That's like if you're working your way along, like, what do we need? The thing that emerged probably the most strongly was this navigation thing about, I don't know who to turn to.
Yeah.
I don't know who takes my insurance, or I don't have insurance and no one will see me. And this is another thing Boulder County's been doing with ARPA money, where we have bilingual, bicultural people who will answer the phone, who will work with you on, what are you experiencing? What are you feeling? Do you think you might harm yourself? Okay, we can work with you and get you to see this person or this person. So I didn't want to leave out navigation as being part of the conversation.
And part of what's happening is ARPA money's going away.
Yes.
And that at the end of this year, is that
Next year.
at the end of 2020, 2026 is going to be a bad year.
It's going to be a hard year.
Yeah. Geez. 2027. I just don't even want to think about it.
Yeah.
But there's a bunch of funding going away. And that's, I'm imagining that this is your response to that money drying up, right?
Well, this was in the works pre-COVID.
Right.
So, and pre-ARPA. So we knew we needed to do this. And what ARPA allowed us to do is try some things and see what we might do and see what we might want to continue doing. But this, I really want to emphasize, this is more than just replacing the ARPA money. We spent about $4.5 million a year out of the ARPA money on behavioral health. And this is going to be our Office of Financial Management. I was going to use an acronym. Projects $13.8 million. So we'll be able to continue the successful ARPA-funded services and do a whole lot more.
So almost another $10 million going into,
right.
In addition to
continuing the ARPA funded programs.
I think there's multiple programs going, or grants going away, right? We had some of the Behavioral Health Administration grants,
it was money for the recovery homes. We had some funding that's going away for jail-based services. Those are the 2 big areas that I'm aware of. I think we lost some money maybe to train up peer supports, and the public health department's losing a lot of money, and they were doing some behavioral health work as well.
So addiction recovery, justice system, and some of the stuff with kids. So this will cover that too.
Yeah.
That'll pick up the losses of those funds going away.
But it's still going to be, even with that, I mean, that wasn't a huge amount of money. It's going to be a good $8 million new money into the system every year.
A lot of the organizations are concerned about treatment facilities in Boulder County.
Mental Health Partners has that facility on Airport Road, which they're moving into a brand new facility in Louisville, where that is almost exclusively substance use. It's the overdose prevention. It's the stabilization for withdrawal. It's what we don't have is that follow on, that kind of long term. Yeah. And we're not. I mean, I know some people in the community. I don't really know what it is they're actually envisioning. We're not going to have a mental hospital in Boulder County. But I think when I talk to people that are providers and professionals in the fields, they're saying we need more things like group homes, whether it's substance abuse or mental health. A place that's structured, it's not locked, but there's staffing, there's support. You're not going to live there forever, but you might be there for 6 months, 9 months, whatever it takes to get you really, kind of stable and back on your feet and ready to be in a less structured environment.
Would 1B help with that?
Yeah.
Those types of programs?
Yeah. There are resources like that in other counties. They are not county funded. The providers happen to be located there. Medicaid pays for some of that. Medicare pays for some of that. If people have private insurance, that pays. The state pays for some of those things.
So we might be able to jumpstart some programs
Yeah.
and have some other funding sources kicked in
Yeah.
to help support that.
Yeah. I mean, the key is a location to do those things.
Yeah.
That's the really expensive part of it.
And the hard part to get buy-in from the community,
Mm-hmm.
right? That's
Yeah. Yeah. Everybody wants the services, but they don't want them in their backyard.
yeah.
So that's a hard thing.
It seems that it's the amount that we are able to put into this is
Yeah, I think
sparse.
that's really the issue. And, people need to understand that the county is not the service provider. So in this area, we do not provide services. We coordinate, but we're not a primary provider of services.
You do fund as well. You're a
Yes.
funder of some of these services. What does that look like for you guys? Do you have a specific pot of money that's for homeless outreach, or how does that?
Well, we don't have, when we do our budget, we don't say, we're going to spend $5 million on homeless services and then decide how we're going to divide it up. We fund the Heidi Grove in our housing department and Trevor. We do an annual grant to All Roads. We do another annual grant to Hope for Longmont, which is their shelter. We do a couple of other grants like that. We also have this other grant source, again, thanks to the voters, called the Human Services Safety Net, and provide some grants out of that pot of money, some of which goes for homeless services. But it's sort of, it's not like a pot that is homeless services. Okay, what are we going to draw out of that?
So would people apply for specific grants?
Well, if it's out of the Human Services Safety Net, we open up a grant application for that. But otherwise, it's directed grants.
Okay. So you work with specific programs that are already functioning.
Right. We have one shelter in City of Boulder, so there's no reason for people to apply. We have the shelter. We also do fund them to do some of the case management work and the coordinated entry work, which you might be familiar with that system.
What about East Boulder County? It doesn't seem as I'm driving through, it doesn't seem like the homelessness is as big of a problem in maybe Lafayette or Louisville and my part of Erie. I'm from Erie. Yeah,
I think it's not as visible, but I think it's there. It's just not as visible. And, we happen to have a shelter in Boulder thanks to the fact that there's a nonprofit organization called All Roads. Yeah. So the fact that there is not a shelter in the east part of the county, it just reflects that nobody started one up. There are some counties that do not have, or, large communities that do not have a shelter to get people out of the elements, and people are sleeping outside. But I think unhoused people find their way to Boulder, City of Boulder, really, because that's where the services are. Yeah. And I know there's some folks, your organization included, that do provide some mobile services.
It's not enough, Claire.
Yeah.
It's not enough.
Not
These
enough.
poor guys are, they don't really know what to do at this point. And there's a lot of confusion on the street. Some of our folks just refuse to go to the shelter. And if they all went to the shelter, I'm not sure what they would do, because they can't all fit there.
Yeah. I guess, again, I know these things secondhand, that, there are some people that just feel safer outside for a variety of reasons. Some of it's trauma. Some of it is maybe conflict with other people. It's a big problem that if you have a pet, you can't take your pet to the shelter. Yeah. There's segregated men's and women's dorms. They don't take kids, so you can't go there as a family. So, there are people for whom the shelter is just not an option. And then they do have rules.
Yep.
And some people just don't want to follow those rules. So, it is not for everyone. Um, I think sleeping in the elements is unsafe. It's unhealthy. It's not humane. I wish there were a solution for that, but there isn't a solution for everybody.
Nope. Need more avenues. Build more pathways, I think.
Yeah.
Does Boulder County have an official opinion about a sanctioned camping area or campground? Has it been brought up and discussed ever?
That has been much more of a topic at the city level than at the county level.
On Boulder proper?
Yeah. Again, because we don't provide homeless services directly other than the coordination kinds of stuff. I think I can speak for the county commissioners. There are 3 of us that we would not favor spending money on sanctioned camping. Yeah, here I'll just speak for myself. What I've seen in the the reports about communities where that has been tried is that it costs a lot of money, and that's money that could be going towards actually housing people in something more permanent than a tent. That if you're going to have sanctioned camping, you want to have some services. And again, where could you better spend that money? That's not to say that something like the Village Collaborative in Longmont, where it's a collection of tiny homes.
Yeah.
I might have called it the wrong thing. Veterans Collaborative. It's specifically for veterans, I think, but it's a collection of tiny homes with a community center. So. We haven't specifically talked about that, but I think just based on the materials that I've seen for various meetings and reports, that sanctioned camping is a kind of a Band-Aid, and we really feel that we should be working on more permanent solutions.
There's an argument that if you have more robust services, that more people will come. And, I can't imagine that that's not true. It seems like that's, but is there potentially a way, if we have these services in place, that we could be, churning out healthier people and get them back into the world? Is that a possibility with 1B?
Well, with 1B, I sure hope that that's the result, is that we have more people who are healthy, who are able to hold a job or be good parents or simply be happier with their lives. So that's certainly the hope. I do want to just say back on the, on the homeless thing and what does the county do. We try to work upstream more on rental assistance. So, I think there's sort of a misperception that people become unhoused because they have a mental illness or a substance use problem. And that's why they lost their housing. That's not entirely true. It's probably true for some percentage of the population, but a lot of times it is an illness that leads to a job loss or some other incident. In many cases, it's the breakup of a marriage or a partnership where people, become financially unstable, they lose their housing, and then as a result of, the trauma and rough sleeping and all the other things, other kinds of issues emerge. And so, we do fund rental assistance. We've tried to fund services to keep people housed who are at risk of losing their housing. So, that's where, at least for counties, that seems to be where we can do the best for people. And then once they are housed, making sure they have the services they need to keep that housing.
And there's a lot of support that needs to happen for a multitude of different scenarios. And
Yeah, I mean, I think we do want to keep it pretty tightly focused on the specifically mental health and substance use treatment. It really is more specifically on, the navigation for these specific services, treatment, recovery.
gotcha.
Yeah.
Your opponents would probably say that this is affecting lower income consumers more so percentage-wise than more affluent consumers.
I have heard that concern, certainly. I think it's important to know that the Boulder County portion of a sales tax, so anything you buy in the city of Boulder, for instance, part of that is state sales tax, part of it is RTD, part of it is the city of Boulder, a little teeny tiny part of it is Boulder County, so it's a very small part of it. And we do not tax food, any food products that are purchased. So our tax, none of our taxes add anything to the cost of groceries. We just agreed to exempt incontinence and menstruation products that the legislature just allowed us to do. So, I think that helps with that regressivity issue.
And I believe it's 0.15%. And that equals, is it 15 cents per $100?
Yes.
Is that accurate?
Yeah. If you're spending $10, it's a penny and a half.
Yeah.
So that would be, yes, certainly clothing for lower income people, that there's housing, transportation, childcare, food. None of those are going to be subject to this sales tax. We're losing federal money. There's no state money. That nobody is going to come to our aid. It's up to us to solve this problem.
What do you see happening if this doesn't go through? Maybe go to speculate?
Well, this is not, we get more than one bite at the apple, for one thing. We can go back to the drawing board and try again. Larimer County, famously, it took 4 tries to get the voters to pass it. I hope that's not the case in Boulder County. I think our voters have a better track record of recognizing needs and being willing to pay for it, but we'll try again.
But with the loss of these grants and the funding that's going towards, I know the County Works program took a big hit. And I think they lost, was it 6 staff?
I don't know the number, but yeah. And that's, so some of that, that's the harm reduction work. We have opioid settlement money, which is continuing to fund some of that work.
Okay.
Yeah.
But
but when the ARPA money goes away, we don't have that room in our budget to replace it.
But what 1B could that would be an example of
Sure.
How would the money be handled and the stewardship of these funds? You said there's 5 major areas. How does that get determined?
Yeah.
Is it
who writes the checks?
Yeah. Who writes the checks?
Yeah.
And what drives them to a certain
that's a
decision?
it's an important question. I mean, people go like, yes, I support that. And few people actually ask that question. So because this is a Boulder County tax, Boulder County will collect the money. We will distribute it to, the nonprofit organizations, including, Boulder Community Health, Clinica, Salute, et cetera. Those are all nonprofits. But what we envision is that we would form an advisory council, and they would advise us on what the areas are and how much should go to each area. So, that's the basic outline of it.
Would those be members of the nonprofit community or business community, or who do you envision the council being comprised of?
We're still still looking at what that would be, but it would most likely be some people with lived experience, some providers. We call them generically subject matter experts, SMEs, more acronyms. Representatives of the local governments that can, talk about what the needs are in their specific communities, school districts, and and folks that are directly in the service provision. So, something that looks like that.
Get the money and then figure out how to spend it.
Yeah. Yeah. I mean, we're going to, our staff are actively working on an exact plan for how to distribute the money that the commissioners will be looking at, assuming it passes in the 2 months between the date it passes and when we actually start having money.
So it would start January 1st?
Yeah, it'll start January 1st. And what my plan is, and I hope this is the way it actually happens, is that so our staff has been working on a distribution plan. They're also working on developing key performance indicators that we will be using so the community knows how the money's been spent and knows it's been effective. We will take that plan to a public hearing, most likely in December, so that we can get feedback from the community on it. And, and then we'll go forward, spend the money, but always have through this advisory council, the commissioners will actually appropriate the money on an annual basis into our budget. So every year we'll have an opportunity to adjust how we're spending it.
So it seems like 26, you're collecting the money. Mm-hmm. So we shouldn't expect plans potentially.
No, we'll be spending it.
You'll be spending it?
Yeah. What we've been able to do with other taxes is, we have a projection from our Office of Financial Management for how much this tax will raise. We will budget 95% of that amount. We'll put 5% of it in reserve in case it's less than, but we will actually be able to budget that on day one. We may not actually do that. We may not budget all of it, but we can. And then we just pay the general fund back as the revenues come in.
So we could potentially expect results from this next year.
Yeah. So I hope we do. I hope to have that. I mean, the reason I say we may not budget all of it right away is that, we do want a chance to find out who's out there that we haven't been funding, that we don't, that might, with a dedicated funding source that's a little, hopefully more secure, that might be interested in doing another recovery home, for instance, or another group home in Boulder County.
So all you service providers out there, get on your mark.
Yeah. Right. Sure. Keep your eye on the county website for news of opportunities.
Pay attention. Yeah. Do you have anything else you'd like people to know about this?
Boy, you've really touched on just about everything there is. I would like people to know about our website, which is healthymindstrongercommunity.org. And there's, fact sheets and lists of organizations that have endorsed it, very long list, and nonprofit, business community, individual elected officials, community leaders, et cetera. So, if you want any additional information about it, it's on the website. There's a way to sign up to volunteer if you want to hand out flyers at the farmer's market, or if you we're doing texting to voters. So lots of ways to get involved. Yeah.
Claire, thank you so much.
Thank you. No, thanks thanks for the opportunity. Great.
Bye, guys. Thank you so much.
Okay, good.